Good evening, friends. I'm Dr. Ajay Shah, bringing this another Facebook Live. For last few days, we have been talking about high blood pressure. We have covered in last five sessions how common the high blood pressure is, how to measure the high blood pressure, what are some other things which you can do to lower the blood pressure with lifestyle changes. If you have not watched my videos for last 5 days, please watch them. Particularly, I want you to watch the last 3 days of videos because those last 3 days of videos included the lifestyle changes you can do to lower the blood pressure. Today, I'm going to dive into some of the aspect of what I do every day as a cardiologist. And today, we're going to talk about some of the blood pressure medications, what you should be aware of, what you should be careful of. So let's start with how common the high blood pressure is treated. Like I said earlier, almost 50% of Americans have high blood pressure. But unfortunately, all the Americans who have high blood pressure, only 50% are at goal. Again, with all the advances into medications and all the therapy and all the thousands of doctors we have in America, only 50% of Americans are at goal for high blood pressure. High blood pressure is one of the most important reasons for dying prematurely, for having many complications, including heart attack, stroke, dementia, Alzheimer's disease, aneurysms, peripheral arterial disease, erectile dysfunction, and many other complications. I will be doing a separate video on complications of high blood pressure probably later today or tomorrow. But to tell you that only 50% of patients are at goal for that high blood pressure is unacceptable. And there are many reasons for that. Number one, patients are not reaching out to the doctor when the blood pressure is running high. Number two, many doctors are not following the guidelines which are set by American College of Cardiology, American Heart Association, and American Medical Association. So you need to be more proactive when you go see your doctor to know the blood pressure goal. So let me tell you the blood pressure goal. If you are on blood pressure medication, your blood pressure needs to be lower to 120 over 80. 120 over 80. So if your blood pressure is above 120 over 80, ask your doctor what can be done. Obviously, the first way, the best way to lower your blood pressure is with lifestyle changes, and you have to watch my videos, which I did over the last 3 days. But while you are trying to make those lifestyle changes, sometimes additional medications will be necessary. Many patients are on two blood pressure medicine, even some of them are on three or four blood pressure medicine. And I always tell my patients it's okay to be on two, three, or four blood pressure medications as long as our goal is to lower your blood pressure. My aim, my goal, my recommendation always will be to have less medication as much as possible and eventually get you off the blood pressure medicine. But while we make those lifestyle changes, including losing weight, including improving our sleep, including starting exercise program, including cutting alcohol, cutting caffeine, meditation, stress management, blood pressure needs to be treated because that's an urgent situation. And that's where medications become an important tool. So don't be afraid of taking medicine, but set a long term. Long term means 3 to 6 month goal of cutting down on the medications and even possibly stopping the medication. And I can show you, I can teach you if you follow our Facebook page, if you watch our YouTube videos, I can assure you that you can get off your blood pressure medicine. So let's work on that. Uh, I also want you to understand that as we get older, the top number we call systolic blood pressure becomes very important, particularly after age 50. The top number is most important, and I want your top number to be below 120 without medication or with medication. The bottom number, diastolic blood pressure, is important, but it's typically is more important in younger population. Matter of fact, the bottom number, the diastolic blood pressure, actually start to go down as we get older because of the blood vessels get stiffer and they don't have that compliance or the elasticity. So remember, as we get older, the top number is very important. Some patients, particularly as they get older, after 75, 80, 85, the top number, if it's kept too low, like 110, 120, they will start to have dizziness, lightheadedness, and at times blackout type symptoms. If that's the case, keeping the blood pressure slightly high, 130 to 150 range is safer and probably medically more appropriate. So again, if you're having dizziness, lightheadedness, or if you're having blackout or passing out type episodes, make sure your doctor cut down your medication and lower the dose of medication to keep your blood pressure between 130 and 150. People who have Parkinson's disease, people who have autonomic dysfunction, they also need to keep their blood pressure between 130 and 150. People who drop their blood pressure when they stand up also need to keep their blood pressure between 130 and 150. And we will have a separate talk on autonomic dysfunction and some of the other issues. But beware that if you're having dizziness, lightheadedness, or blackout, you may need to keep your blood pressure slightly high, like 130 to 150, and even sometimes I have kept blood pressure of 160 in some of my patients. Obviously, best best judge of where your blood pressure should be, your own doctor will decide that, and you stay in touch with your doctor. But as if you are aware of it, you will get a better care and you will get a better treatment. So let me quickly summarize some of the important classes of blood pressure medicine. One of them is diuretic. That means they are the water pills. That's actually one of the common blood pressure pill. We use diuretic as many times first line drug, uh, particularly in African Americans and older patients. But it's commonly used in every type of patient. Some of the common names include hydrochlorothiazide or diazide or maxide or spironolactone amlodipine or Norvasc or cardizem or verapamil. It's one of the older class, been around for 35, 40 years, one of the very effective medicine. Matter of fact, amlodipine, one time, 15 years ago, was the most prescribed blood pressure medicine in the world. Very good medicine and very safe medicine. The next class is ACE inhibitor and ARB, angiotensin receptor blocker. They both are good class of medicine. They both work through angiotensin axis and they both effectively lower the blood pressure. Some of the common names include lisinopril, ramipril, losartan, valsartan, some of the other medications. And the last class of drug which we are using somewhat less now is the beta blocker. Beta blocker has been around for 55, 60 years, a common blood pressure medicine, but typically used as a second or third line drug, no longer a first line drug. I actually use ACE inhibitor and ARB as my first line drug, a diuretic as a second line drug, calcium channel blocker as a third line drug, and and beta blocker as a third or fourth line drug. Obviously, every patient, we need to individualize which drug is most appropriate, and your doctor can do that. Uh, but ultimate goal is to get off the blood pressure medicine. So try your best with lifestyle changes. What the video I've done on YouTube, they are already available. Watch those videos again and again. More of the lifestyle changes you make, higher chance of you getting off the blood pressure medicine and getting a more healthier life. So try your best to make those lifestyle changes and get off the blood pressure medicine. So I will end right now the live. I will be doing another live around 9 or 9:30 tonight. Uh, Please stay tuned for that. Please share this video if you think your friends and family will benefit. Please watch it on YouTube. Subscribe to our YouTube channel. Invite your friends and family to like our page. And if you really are enjoying it, I will truly appreciate if you have comments, if you have questions, if you have concerns. Please go ahead and do that. And if you like this video, that gives me a boost, that gives me a motivation that what I'm trying to achieve has been working, and people and family and friends are learning, enjoying, and making some healthy lifestyle changes. So please go ahead and like the video if you truly enjoyed it, if you truly learned from it, share with your family and friends, and subscribe to our YouTube channel and watch the videos on YouTube. Thank you and have a great evening.